This 26 years old man has a pretty obvious deformity of his nose, is complaining of functional issues, his breathing is extremely poor, and he had the trauma, he also sustained trauma in 2018. He defines his nose as a long, huge, big nose and a droopy nose. And you can actually see from his front view that there surely is an excess of width. There is some asymmetry in the nasal bones, a little bit of deviation to the left side. And going down in the analysis, his cartilaginous vault narrows a little bit, and then his tip is a massive tip with a parenthesis configuration of his strong and bulky lower lateral cartilages. And this, the same, you can actually see on the basal view, where this massive shape of the lower lats becomes quite obvious. On the three-quarter views, you can actually see the droopiness and the excess of both skin and structure in the lower third of his nose, and even more, this can be assessed on his profile. On his profile, actually, you can actually see, that his bony radix is a little bit too tall, his length is excessive, his projection is a little bit too much, and the droopiness is due to the fact that on this specific spot, the septum ends and the rest of the nose is hanging on the septum, and that's why it's so long and so droopy. This is actually worsened by his relative degree of chin insufficiency. I suggested a chin implant at the same time, but this is something he doesn't want, and so we won't be performing this. It's a little bit of a pity because this could have contributed strongly to his better overall shape. Now, my plan here is to open this nose up, since we'll be doing an open rhinoplasty approach. This will be also important since I'm planning an extensive degloving on this nose. His skin is so abundant, it's so redundant, that the better it will be redistributed by a wide degloving, the better it will be. Then I will access my septum. I plan a perichondral periosteal flap, component separation and incremental reduction. And probably I will go after an osteoplasty more than an osteotomy. It's a man's face. His nose doesn't have to be too narrow, and especially osteoplasty will be a little bit safer considering that I will do extended degloving, and that will give me a little bit more control on the final situation of the nasal bones. If I will have to do osteotomy, this is one of those cases where I will have to suture my nasal bones by transosseous suture. I plan a septoplasty on him, and this is due to the fact that, as I should have shown you this before, but this is due to the fact that he has a massive deviation on the right side. He has an obstructing spur, which is really killing his right airway, compensatory hypertrophy of the turbinate on the other side, and this is also clear on the 3D rendering. On the front view, you can actually see his deviation here and the shortness of his nasal bones, which contribute to the bony hump. Anyway, going back to my surgical plan, regarding the tip, I will have to suspend this tip since it's so hanging on the distal septum. And that can be done by a tongue-in groove if the septum is long enough, which I doubt, or by a septal extension graft, which is the most likely thing, on which I will ride my lateral crura in a lateral crura steel kind of consideration. And I will have probably to strengthen my side wall as well, possibly with articulated grafts. Now, if my septum may need it, since my septum is really so deformed, I am planning in cases like this to use a perforated ethmoid plate, since that will really help me in keeping this septum straight. So the mainstay maneuvers which I plan to do are full degloving, osteoplasty rather than osteotomy, tongue-in groove or a septal extension graft together with lateral crura strats. I will probably associate some degree of underlay, which is a turn under of the lateral crura since they are so bulky, and I may have to strengthen the septum by straightening it with a perforated ethmoid plate. So this is my planning. So this nose has been infiltrated, his vibrissae have been shaven, and we put 3 gauze packs in each nostril, so it's 6. And each pack has phenylphrina, which is a nasal decongestant. It's like Otrivin, essentially, since of course you cannot use cocaine or anything like this. I have his pictures on the wall, and I have my list on this side. So I can I can actually see the border of his lower lats. So you've seen before I use usually a couple of small hooks, but he's so wide that we can just do this quickly. Like so. So you know, for instance, Wolfgang, he first does this, then he puts an instrument here, and he cuts on top, right? I don't like this. One of the reasons he does it is that he wants soft tissue enough, but the way I do it, I have enough soft tissue anyway. Now you can see his anatomy here. So see his columellar vessels. One has a bifurcation here, and the other one is this one. So one bifurcates. What I like to do is identify them and buzz them one by one so they don't really harass me.
I thought you wanted to save some medial crura from the damage of the first incision.
Oh, that's okay.
No, Wolfgang.
Ah, sì, sì.
For this incision.
So I'm already speeding up things by some dissection here. All right, double hook. So blood pressure is so important. In young males it can be a little bit of a problem, but now it's less than 70, 63 actually. I can see the edge. So I have played with the idea of doing a subperichondrial dissection of these lower lats, but I have to tell you I abandoned it. It was a thing that Boris Kakir had suggested. Rowling tried it for a while. You can actually already see the shape of these cartilages. Devo, Antonio, bagnarmi le mani. Aspetta un attimo solo. Sì. So it's interesting that his skin is not that thick really, and that there's a lot of mass depending. I can do this with the scissors or with some other instrument, and I just peel off. Scolla. Quello che vuoi, anche da denti adesso. I peel off this soft tissue. So I'm not really subperichondrial, but I'm almost subperichondrial. And I still have this columellar vessel, one of them, which is fighting. Okay. Pressione. One thing we are using, I work here with two anesthetists, and we are using, what is it? Tranexamic acid. It's something, this was Pitangis ligament, blue. Some people are talking of reattaching it. And if you look at the anatomical studies by Peter Palazzi, this thing is a ring which connects down here. And there's someone like Kirill Pshenikov from Moscow who is talking about sparing all this, but you know, it's a lot of trouble actually. He was also talking about re-anastomosing the columella vessels. So when I start a case like this, you know, one of the first things I do is I take a feel, meaning I can actually, dammi l'uncino grosso, understand what this case is going to mean for me in the next hours, since it may be that it dissects easily or that it does not dissect easily. And in his case, dammi la forbice, I can see that his dissection is going to be quick and easy, since there's a very flimsy attachment, non tirare così, of all these structures. So I am kind of, it's simple for me to just deal with them. All right, so we can see the septal angle down here. And sometimes I do this preventive hemostasis kind of thing, abbassare il bipolare. And now, sometimes I will even swipe my finger. I know it doesn't look very nice, but it's efficient. Since I have realized in him that his skin envelope is rather easily freed from the underlying structure. Tira su così. Dai, con l'uncino. Okay? So I go down here. I will just open this up. Another tiny bit. I'll do the same on this side, and I will abbassare un po'. So what I was telling you is that people are different, and in a case like this I can see, tieni ferma la testa, that it will be easy to peel these structures just away. I like using my stout debakers and just do my dissection. Now you can see this structure here, it's a nerve here. It's always kind of present. And here's one of those in which I will actually push things. And this will allow me to start my degloving. Avete bisogno di qualcosa? So now, since we decided to deglove him fully, forbice. So this nerve is a constant finding here. You see it? And you see it here. Anyway, I have to get rid of it. I don't think it makes a difference. It's not a vessel, it's a nerve. We'll do the wide degloving on him. Look where I am. I am already down here. So I'm really doing an extended degloving. And let's have a look at the inside. And you can see, I can see the shape of the nasal bones all the way. All right, I left this tissue here, but my degloving is really up to here. So that's a wide degloving on the right side. Why do I do that? I said before, because he has large redundant skin envelope, so I wanted to redrape. And maybe, as I think it was Garifaglia who said this, he has bone asymmetry, so if I need to do it, I will do anyway his osteotomies by piezo. Okay? So it's wide degloving on both sides from here to here. All right, so this is indeed wide degloving. I want this envelope to do its work. Should I need to do some desmassing? Yes or no? Well, I want to do some, just limited. It's pretty strange because he has less thickness than I had thought he had. Dammi il blu. Apri Antonio quelle nuova piezo da taglio. I may need just a tiny bit here. Uncino doppio grosso.
Tanto poi dobbiamo per forza fare.
So let's just do this directly. Forbice. Troppe garzine piccole, dammi quelle più grosse. Antonio, un grosso naso, devi essenzialmente darmene grosse.
Respiro. E vuole che lo teniamo?
No, no.
Via.
Sì, sì.
Così non aumentiamo la discrepanza tra busta cutanea e contenuto.
Assottiglia un po' la busta cutanea, guarda. Me ne frega assolutamente niente. So I'm not really doing much. I'm peeling some of this tissue out. That's all I'm doing. See the fat just below it? I don't want to touch it. That's fine. If you really come close, you see the vessel here. Okay. So I'm really not causing any injury. Bene, puliamo. So let's clean this up, this mess a little bit. You see we put opsite everywhere, on the eyes and on the mouth. And this has a little bit of hydrogen peroxide. So, dammi l'asciutta. So, let's start now, dammi l'aufric largo, in the same way as we did before. So we have an extended degloving. We have a rather wide dorsum. You can actually see where he has this thing here and this thing here, which are causing, metta la front view nell'acqua, which are causing on the front view some irregularities. Mettete la front view. So if you look on the left, of course, I'm not talking of the simulation, you see the contour irregular. No, that's a good one. You can actually see that contour problem, especially on the left, which is visible now. All right. So I usually put a little sponge with hydrogen peroxide. I learned this from different surgery during, actually in Bosnia, so it works pretty well.
Ok. Inizio con anelli.
So, tira.
L'altro.
Anche a me anelli perché facciamo prima, li teniamo entrambi.
Una.
Va bene, ci mancherebbe. So this maneuver is the one by which I take some of the soft tissue. Now, un momento, aspetta. Are these clean enough? Dammi la lama. Boh. Essentially, yes. Now you need to pay attention not to make a hole here. So I'm checking it on the underneath. Stendi bene. Stendilo verticalmente. So I'm always feeling my mucosa. Frankly, there's not much space. Doesn't have much soft tissue, frankly. This is mostly kind of flimsy.
Spira, non mi lasciare. Dammi le garze. Quanto è il blend? Spira. So if I have a hole in the mucosa, I will just deal with it. So I'm checking my mucosa all the time. And this soft tissue is the one I will use for something at some point. So as imaginable, his septum is really short. So we have to get this thing in a better shape. Okay, so I see. There's a lot of space. You see, it's almost as if somebody, see why this tip was falling, there's nothing holding it. Finally, we found the septum. As I had imagined, this septum was short. There is actually a space, like a full centimeter here, in which there's no septum. So this thing was falling down. So once you have your septum exposed, I use one of these two instruments I showed you before. So this is the one that is a scraper, but it's not very efficient since it's kind of oldish. So I will get to mine. Dammi la lama, quello mio. Piano.
Cercando di metterle un po' di
So
peso.
I just need a minute touch with my blade. Dammi quello da denti. And I take a little bit of time. This is again a dental thing. Aspira però, per favore. Dove serve, Antonio? So it's so crucial to find the exact plane here. So once I have identified it, it's an easy matter of taking down this in a single sweep. Yeah, it's a usual problem. Sometimes this still, this is not always easy. Sometimes this plane is a little bit tricky. You think you are on the right plane, as you all know, and then you are not on the right plane. And instead of being on the right plane, you're on the wrong plane. Sometimes I lightly score. Spira.
Respira.
I just want to make sure this thing is correct. Spira.
Sai com'è quando
And there we go.
per proteggere.
So it did take me a little time, and if I have a doubt, though we have a certain experience here, it's still a fact that this plane needs patience. I want it exactly right. Now, is this septum flimsy? It's relatively flimsy. It's kind of flimsy. So next step, we have to go for the Nazim flap. All right. You can see I have already developed it. Now I go with the elevator. Next step. And I will ride it until I hit the bone, but I don't have to go below the bone. I have to go above the bone. Otherwise, I'm in the wrong plane. So I'm using the elevator, tienilo fermo, to cut on top of it. And I hit the bone here. It's a sizable flap. And see the beauty of the dental elevator? It's not really a dental elevator, it's a little bit modified, but Marina Medical should make it. It's almost a dental elevator. Lama. So I am on the bone. You see I'm on the bone. Spira. Lava bene. Dammi lo scolino da dente. Attenzione al tessuto. Tienilo fermo.
Sì, ciao.
Gira di là. So I tore it up here, but I can kind of rescue some of it. There we go. There's the ligament. And the reason I tore it is that there's that little notch here, which is the upper lat, which is going below the bony cap. So I'll try to keep its integrity on the other side. Okay, so aufrecht largo. Let me restate all this so we go under magnification. Essentially, this flap becomes really flimsy at the bone, but I will still use some of it. Tieni qui. And that's it. It has a couple of holes, actually. I was expecting it to be a little bit better than this. Sì, sì, sì. So it's kind of flimsy. It's kind of flimsy. So let's have a look at how to do it on this side. This is below the bone, sorry, above the nasal bone here, and that's the ligament. Bagnare però perché se no non si vede niente. Mettilo in tensione.
Sì, scendo un pochino.
Gira la testa verso di me.
Spira.
So after all, it becomes really, you see, it becomes flimsy here. But on this side, I was a little bit more careful. And I was able to actually raise most of it in continuity, and that's going to be enough. So frankly, it's not that thick. I would have expected thicker flap. Having done this, we have the keystone exposed, scolla. So before I actually split the components, let me show you this. You can see the line where I will have to split it, which is here. Can you see it? It's not here. If I go flush to the septum, dammi la lama, the 15. If I go flush to the septum, I will actually use a different path. I have to go like so. So, you can actually pretty well see here the way this thing is shaped. So that's a septal T. So you can actually see, look here in detail, how this bulge was the upper lat bulging in a cleft. It's called, it has an anatomical name now, which I think Rowland devised. So there was a cleft here. There's always a cleft. Look at this, all right? And look at this on the other side. See the way, tra un attimo mi metti il 3D con l'osso davanti. See the way this bone is shaped with a couple of nooks. It's like a couple of valleys in the bone. And see the render, the 3D imaging. See the way that I can't point it to you because I don't have control on that image, but if you look at the bone, you see there's a valley to one side. It's like an isthmus, and another one on the other side. And that's what we see on the right. You can actually see a wider one here and a narrow one on the other side. So having said this, let's separate this a little bit from the bony cap. And this is a good example to show how much this cartilage extends below the bony cap. And do we need to take this hump down? We will take it a minimal portion down, just a tiny bit. So I will probably avoid taking my septal T, simulazione sul profilo, lama, because essentially all I did there is not much. It's a minimal modification. Actually, I am going to deepen my radix, prendi la fresa per la radix. So all I will do essentially here is bevel this, go back to the picture. But I won't change this architecture significantly at all. See this hole? It's a hole which is bleeding, and there's a vessel through it. So when I see a lacuna, I go like this. I use my coag, and that's it. I do not use any bone wax. There's always a vessel when you have these congenital lacuna things. And look, it's bilateral. So when you have holes like this, they hassle you. You go in with the Bowie tip. No, fai vedere il buco. So Antonio has prepared the striker saw, but we don't need an oscillating saw here. So Antonio had prepared this, but we don't need it, because we don't want to lower it. So I'll ask him something to take the radix down just a little bit, and I will refashion the radix just a little bit under direct vision. So I'm lowering his radix a little bit.
Dr. Robotti, hello.
Yeah.
Just a simple one. What setting do you use on your coagulation?
I don't know.
Okay.
The coagulation is probably, it's an old machine, non so. It's a blend for the catin, and the coag must be, quant'è il coagulo? It's very low.
Yeah, it's very low. I would imagine that.
Yeah,
Thanks.
Yeah. 2.7, she said. So I don't want to catch my flaps here, Scolla. But I like this way of lowering the radix just a little bit. So, do I need much of this? No. But I thought, looking at him on the profile, that I may need to deepen his radix just a tiny bit. Having said this, let's go to the piezo, so for demonstration. And the reason is I have to begin some osteoplasty work, and then we'll decide if we want to do an osteotomy or not. You know, in males, if I can manage the shape of the nasal bones without osteotomy, I prefer. And the two things we have here are due, verificate se non faccio degli errori, to these things here, and especially not to the bone, but to the cartilage protruding here. So piezo here becomes a good indication, since it's you obviously see it spares the cartilage completely. It spares the cartilage completely. It's not injuring it. Garifalia, if you're there, you told me, would he need osteotomies? I said maybe, but when I spoke to him, trying to convince him, the last issue he raised is that he liked his dimples on his bone, which I, of course, will reduce, but I don't really want to change that much. See the effect here? All I really need now is this area. Andiamo dall'altra parte. Piezo. And you can do this with a burr. Prendi la fresina. Yes.
So essentially you thinned the bone over there.
What?
You have thinned
Of course I thinned
the bone,
it. Yes.
And you have exposed more of that upper lateral.
Yes, because I know that the upper lateral extends in a thin area of bones,
Yeah.
which is the edge of the bony cap. So
Yeah.
my new dorsum if
Yeah.
I don't do osteotomy, and if I do osteotomy anyway, will be mostly a cartilaginous one.
Yeah, fantastic. You'll do the same on the other side?
Probably yes.
Yeah, thank you.
But on the other side, I'll show you with a different instrument. Ce l'hai la fresa, quella che tonda? So one of the main things that piezo users say is that with piezo you will not injure the cartilage. But if I do show you this,
Level?
my main problem is safeguarding the flap, of course. So Francesco has to do this. And cattivo Antonio, non so se hai sentito. Meglio così.
Cos'è che hai detto?
Non ha sentito Antonio, lascia fare.
Non è una cosa cattiva. Così imbarazzante.
So why am I showing you this? If one is careful with a power tool, you are not killing the cartilage below. So let's go back to piezo. It's the same concept. Of course, with piezo, even if you want to kill the cartilage, you won't kill the cartilage. And as you were saying, the real problem is evident. It's not a bony problem. It's not a bony problem. It's this cartilage projecting out. Actually, I have no interest in this company at all, but they supplied the machine to the clinic. On Saturday they are coming, and if you want to try on a piece of bone, you can try on Saturday morning.
Saturday morning, yeah.
Molto dipende sul serio, gente, dagli inserti. Se sono nuovi è un'altra balla. So this is a good demonstration on how the shape of this new dorsum will be due to some cartilage work rather than bone. I am not going to do an osteotomy for the reasons I mentioned. But I will do some further osteoplasty.
Funziona bene?
Sì, sì. Spero bene. Now with piezo, if you want, or with anything really, even with a burr, you have a lot of thickness of bone here at the junction. It's not the nasal bone junction, it's a frontal process actually, but here is a spot where you can actually thin it rather liberally. That's what Boris is doing with his own instrument. Va bene, sai.
Sì, non lo devo dare. Rimane sempre quella triangolare.
So, we have this problem, of course. Dammi una... Dammi una lama. Ancora un pochettino qua, aspetta. Dammi ancora il piezo. Attenzione, che qua. Dammi lo scollatore. Attenzione che c'è il lembo qui. Si vede? Sì. Knife?
Demo.
I'm just freeing this flap a little more. Sì, dammi una lama fresca però, Antonio.
11?
No, vabbè, non importa, però è assolutamente... So I'm freeing completely this flap, frankly, on both sides. Okay, I'm not going to do osteotomy in him. Skull. Just. We will do some osteotomy at some point. It's not that I don't want to show you. Questo ripieno è buono. È buono questo.
Ah, come...
Sì, sì.
come presa. Io ho detto, l'avevamo già commentata.
Alright, so
Abbiamo detto che la punta è un pochino più stretta e quindi
now we
forse
could
per
manage it with sutures, we could manage it as we want. I'll wait before I trim it. I of course have to take care of this bulge and I'll see how. Suturing is an option. Some just incising a little bit is another option. But I think this dorsum looks pretty good. Now let's go back. Bene. And let's deal with the septum. So does this septum have to be shortened? And my answer is no way, because my tip was like this. So this septum is a God-given gift, since I will use it to resuspend his tip. It's straight, it's in the middle, and the deviation is posterior.
Dobbiamo stabilire cosa intendiamo per deviazione. Se quella alla punta o quella al setto posteriore.
Boh. So I have decided not to take this down, and I will deliberately leave some of this shape. I see no reason, and maybe here's a case in which, this is a good point you have to understand, he could be a good candidate for the push-down technique in case that works under open, and I see no way of taking down his septal T, putting the spreaders, and then putting the epaulets on top. I will probably resuture the epaulets on its original place, since this is wide enough, or maybe I will splint just a little bit. So I keep an angle here. I left a little bit of extra space in the front. Another advantage I didn't tell you about the CT scan. I didn't watch it this time, but it gives me a good idea of the percentage between quadrangular plate and ethmoid bone. So usually I will know, at least to some degree, if I have a good portion of cartilage or not. Fai vedere l'attacco con lo sperone.
Questa proiezione.
So you see the spur on the right side, l'altra attack, la coronale. Okay.
No, ci sono scusate.
Va bene, so here's a tilt as well as a spur. Here's both. When you go with this thing, which is the bone scissors, you should not go like this, you should go like this. So one of the main things is that this thing has to come not like so, but like so. Tieni fermo. Sometimes this will become dislocated. Yes. So I'm really careful here to be kind. Work my way around it on the vomer. Scollo.
Can you see the...
Something I want Peter Palazzi to give in Bergamo is it's a nice talk on the anatomy of vomer and septal spurs. He gave it for the first time in Baden-Baden. It was wonderful new anatomy. Totally new.
New one?
Sì, sì. So, as well as a septal tilt, I have a spur which comes like this. So my plan is to use the piezo in this fashion. Dammi il piezo da taglio. And I know it's hard to see, but I will do this thing. Non vedo il pedale. No, l'ho visto. Respira. So, if possible, you can try and come in. There we go. Okay. And I think I already did it, since my impression is that this spur is out already, although it's out to some degree, although oftentimes this will cause, hold it, it's not out completely, of course. It will cause a mucosal laceration. Bello questo. This is one of the best indications for piezo, really. Taglia che è una meraviglia.
La punta è vecchia?
Questo è nuovo.
There we go. So why don't I show you this? Pinza lunga, the baker. So this septal spur, which is always a mixture of a little bit of cartilage and bone, was exactly like this. So I cut it with a piezo. And that's really a good indication for it. Now what Antonio will do, he will take care of this cartilage, and that bone he can throw away. So now I can tell you he's free of that problem, at least. Okay. And on the other side, let me check, but he didn't really have any major issue except the turbinates. So my mucosa is okay on the left. I have a laceration on the right, which often happens when there is a septal spur, but I don't really care, since one laceration without an opposing laceration, I will just leave it, of course. All right? Now I will clean. Okay? And now let's take out that septum left here. And you see that the spur was down here. Did you keep it? Ce l'hai ancora? The septal spur, no, was here. And this was the deflection. And I can have an ethmoid. Okay, so this, he took the cartilage out, but this thing was like this. I don't really have my hands free. It was like this, okay? Now you can see it. He took the cartilage portion off, which was extended from here, and see the use of the piezo device, which is really brilliant. Sparito. Lo piezo. Which I used to cut like this. So now I have this. This can be dumped, the cartilage he took out. This can be an ethmoid splint if I need it, and this is some septum. I don't have much because his septum was short to begin with. So the big turbinate is the left one. I already infiltrated it. So I was asked before about this. I just do electric. Che tieni la testa? A cut here. Aumentare il coag. I'm feeling the turbinate bone actually. Scollino. Bene, tienilo fermo. I'm going on both sides of the turbinate bone. It's not much of a bone. There's not much of a bone. Is it mucosal or bony? Is there bone at all? Well, there's not much bone. There's not much bone. It's mainly mucosal, actually, yes. Anyway, there it is. I fractured the bone. I'm not going to take it out. I'll do the same on this side. collar. Feel the bone. There it is. I broke it already. And I won't do much else with it, frankly. There it is. I need to break this a little more. I know it's not easy to see this. So once I've done this, I will use my coag tip. I will raise the coag thing. This is a Valley Lab. I will stick it inside. Alzarla. You can see it blanches the skin, the mucosa, sorry. It behaves like a thermage kind of thing. So I do these multiple holes. That's the way I do it. It's not very difficult. You can see the little bit of a retraction. Sta andando bene lui, sì. Maybe if I did use the radio frequency, but I don't know. I think I'm happy enough with this thing. Now once I've done this, I take my bipolar and I just make sure that the edge doesn't bleed. I'm not using the bipolar on the turbinate, I'm just using it on the axis. Then I take my scissors, my big scissors, forbici, and I just feel it, lateralize it with some force, not too much, and hear this crunching noise which I want to hear. Vi lo ricordavate Luca quando faceva Antonio? Il nitrito, eccellente il nitrito. Now we'll put the marrow cell in a short while. He's really open. Now one thing I can see, there's a little bit, this is interesting, looking at this side, there's a little bit of a bony ledge here. So I will look for it. So I was inspecting the cavity. I saw there's a little edge here. So I want to actually take care of it, Aspira, and see why. Here it is. And that's the vomer. So what I will do is I'll use my piezo is a good thing here. Dammi piezo. And just get rid of this irregularity here. Although this cost me disinserting the rest of the septum from the spine. There you go. So, yeah, now that took care of it. Now this cost me disinserting the spine here. No, well, almost, but I'm not going to trust it. So, first thing I'm going to suture it back, yes. Sì, dopo, dammi l'elettrico. So you see the nasal spine here. Sometimes, seal drill, sometimes this thing will just fit in the middle, like this time. I just need to put it back in the middle. Sometimes I will split my spine, sometimes I will do other things. So, sutura. So I made a couple of holes obliquely. So this is proline 5-0. And now I found the hole, this time. I will pass it through my cartilage. Vediamo di farlo passare. It's a little tricky here, but I was lucky this time. This time, in compensation for what I did before, I found both. So this is a hole that comes obliquely, and I can sacrifice the stitch since I'm not going to use proline anymore. Can you zoom in? sugar. So this thing is solidly here, but look at the shape of this septum. It's a little bit weak, so I will show you I'll use the use of an ethmoid splint this way. So I was saying this septum is a little bit weakish, so I will show you the splint like this. I will place it like this. Now, while we are waiting for the new tool we will use, let me infiltrate the cartilages. Mi dica se facciamo qualche cazzata. Bene. So I just prepare myself for this dissection. I'm just infiltrating here a little bit. No, va bene, già fatto. Infiltro, dopo, non lo faccio adesso, voglio solo, I'm just infiltrating. So, my rationale here is this septum decent? Do I need to stiffen it? Possibly I could leave it like this, but this fellow is a male with a lot of skin. I don't want him to deviate in a year or so, so I will splint him. So my L strut is shaped like this. This is kind of weak, so we will put a plate like that. So this is not much. Dammi la forbice d'osso. But I will use it. Forbice d'osso. Pronta la fresa di Gubish. So my plan here is to perforate this thing and put it, let me just see if it fits, and put it here, all right? So I will strengthen it to some degree. I know it needs a little bit of work here. I have some residual cartilage here. Okay, this is the burr I used, which is Wolfgang's burr. Now this bone is not wonderful. It has a very thin portion. You can actually perforate with a needle directly, and a thicker portion. But I think it's worth... Now frankly, this is also for demonstration purposes. I would do it in my case anyway. See, it's okay now, all right? It's better. Maybe we have to take this portion out, forbice. All right, fresa. I'll show you the piezo. You can do it in any way you wish. No, maybe this is better for them. Mi metti quel coso sotto il suo affare? Sì. And when it gets thinner, it may break actually, it's very thin. All right? And since it's conical, bella questa, vero? Devo dire che sto rivalutando quelle mediche. Gliene apriamo un sacco, aprigliene un altro, poi magari le vuole indietro. Okay, antibiotic solution here. We're always keeping these grafts, these things swimming in antibiotic solution, which is what? Cephalosporin and gentamicin, right? So let's see where the weakness is. I think the worst portion is this one. So this is also for demonstration, really. Maybe I will put a small spreader here, so I don't want to get into a space which I may need. So essentially, I will do this, but forbice. I can just That's probably more than enough. This works pretty well. Now I don't want this thing to cause me, no, Aggie, to cause me problems when I have to suture the cartilages. So this is the wrong needle, but it doesn't matter. All right, is that clear? Aiutami però.
Sì. Aghino anzi. Si vuole lasciare quello.
What's his blood pressure?
69.
So his blood pressure is 69.
Systolic.
Yeah, I think the blood pressure control is just essential. Sì, ma ci passo.
Anche ritorno?
Sì. No.
Ok.
Avvicina, però scegli quello giusto. Questo.
Quello vuole?
Quello lì, dai.
Questo va bene?
Okay. So he's showing me the needle, I'm getting in the needle, and I'm coming out. So I use the needle as a guide.
Serve ancora.
All right, so is it worth doing this? Maybe. I think so.
È attento però.
Otherwise I wouldn't do it. Key. So if you forget making a hole, dammi il piezo. We can make a hole now. And see this just goes like so. That's cartilage on the back. Sutura?
Passato oltre la catena.
Sì. Questo dobbiamo fargli un sacco di lavoro alle cartilagini. So instead of finding this hole blindly, so if you don't have this, all you need to do is do this, all right? And where the bone is thin,
Scusi.
if the bone is thick, you need some time, but you can just do it with a needle. I have this instrumentation, so it's easy for me. Troppo lunghi, eh?
Tutti?
Sì. It's probably enough. So did this thing work? I think so. I think it changes my perspective. I left a space here for my small spreader. I left a space here for my suture. So we just did some osteoplasty. We lowered the radix. We have these things jutting out. We have to do something about them. And these are the dorsal lines. So it's almost a matter of suturing back, but I will need a little spacer here. So let's go for a couple of spreaders anyway, which will be below the horizontal V-shaped, like an aircraft carrier V-shape of the septal T. Budimetilene?
Abbiamo ancora scollato la mucosa.
Dopo, sì. So if the septal T is like this, I will accommodate my spreader here and here. I am reminded, without any mercy actually, that I have to do something which I would have done anyway, but infiltrazione.
C'è il tentativo.
Lo so, perché vuole corda, ma non bisogna...
No, non della corda, dell'inglese.
And I don't want a hole here. If I have a hole, I will suture it, of course. But I'll just try not to have one.
Aspira.
Andato. Okay, so I freed the mucosa a little bit here. Beep.
Guardate le presentazioni che ho fatto prima, hanno chiesto qualcosa.
So see this thing here? Give me my dental thing. This is not sharp enough. Dentale. Scollino dentale. So you can see why I call, if you think of a Joseph elevator, it's Jurassic really. So that's a demonstration pretty clear of what of bringing this mucosa, letting this mucosa down a little bit. I want this thing exactly here, so it's 2 centimeters. So let's get the septum. From that septum, I really don't have to do much to the alar cartilages because there's so much. So I have enough. I can play with this pretty well. I may give something to Antonio to dice. See?
Dr. Raboti, can I ask a question?
You sure can.
If you are planning to use bilateral spreaders,
Yeah.
are you contemplating to keep the right one bigger than the left because of the initial deviation?
That's a good point, and you know I hadn't thought of that. I may have less of an indication for that since I did take out some of the bone here. But you are right. That's a good point. I will probably use a little wider one to the right side. Let me put a spreader on the left, which just comes below the septal T. Bene. Then I will find a better piece of septum. No, that's enough. Yeah.
That's enough.
Yeah. So here I don't really need much. Now, I don't really think, you know, it's always a matter of judgment. I don't really think I should do an osteotomy here. I don't think so. So I just want this exactly below the edge of the remaining T, non passare dalle triangolari. Orizzontalizzalo.
Non volevo danneggiare la triangolare.
Dai, orizzontalizzo. All right, that's it. I know in the other one I did it a little bit wider on the caudal side, I think, but there was no real reason for that. I just didn't want a wide portion at the keystone, that's all.
A questo punto ho girato un po' la punta.
Bagna pure. Thank you for saying this. I have to say, though, in doing this now, I am actually seeing the need of a wider spacer on the right. Now, before I take this final decision, let me just inspect once more the shape of the nasal bones, just in case. No, I don't think there is a reason to do an osteotomy, although there will be a reason now to play with this axis here. But we'll do it first. Let's put another spreader on this side. Let me look for a piece which is a little bit wider. Do I have anything else? O altro? No, I don't really have a better piece than this. So maybe I will put two. Maybe we'll stack it, okay? So let's see if this is needed. No, va bene. Abbassa, tira via gli aghi. Piano, piano, piano l'altro. Sì, certo.
Adesso come posizionare questo? Questo è subito che volevo mettere.
Bagnare. So I'm kind of boosting the architecture which the nasal, the septal T has on its own, all right? I'm kind of widening the septal T, but I didn't have to take it out since I'm not lowering her hump, his hump.
Ago?
Aspetta, tira via il lago. Alright, so I'm kind of joining everything now.
Ok.
Bene, so I'm joining this spreader to the plate.
Taglio.
Buona l'immagine. And I'm bringing this septum a little bit more in the midline because it's almost a clocking suture in a way.
Molto bello.
Bene. It's wider here, this area. Complimenti per la pressione perché è proprio necessario che andiamo avanti in un modo siffatto.
Tolgo.
Sì.
Lavo.
So I am postponing this decision, but I have to do something with those protruding edges of the upper lats. So I will just disinsert them, I think. So I kind of straighten them somehow. Bene. Bene, no?
Sì.
All right. So I just kind of cut it off. Antonio straightened my needle.
Sì, metti dritto il lago.
Allora sarà da qualche altra parte lo zaino. Sarà forse qui, non lo so. Allora in casa in sala riunioni, ma lasci perdere Mattia. Però ci ricordiamo, Va bene?
Domani mettiamo sulla insala. Serve subito il resto del set o mettiamo via?
No, no.
Puoi mettere via l'estrazione.
Taglia. Lungo.
Va bene?
Sì, sì. So let me just check before I do anything else the height of this dorsum. Height of this dorsum looks good. And let's start freeing these cartilages from, because we will have to do a sizable work on these cartilages, of course. You know, I'm thinking that maybe we'll just do a domal overlap. We'll see about this. Non me lo tirare. Va bene, ok, va bene così.
No, vado bene.
Va bene. Tira qui una. Forbici adeguate, non queste piccole. So he really had a bulbous tip. I used to use hydrodissection here. It takes me too long and it's okay like this. But you have to be a little bit careful. So tira da una parte.
Questi dubbi esistenziali da adolescente.
Te lo do io i dubbi esistenziali. Io sono molto sensibile verso i dubbi esistenziali.
Ma c'è un consulto tra colleghi, tra Aldo e Leno.
Tira. So I'm just freeing this a little bit since I will of course overlap it. I need the space. I will turn under it and so I need the space to do this.
Dr. Robotti,
Yes.
I know you haven't maybe decided whether you will overlap the lower laterals, but let's say you wanted to, which maneuver would you do first? Would you do the...
Well, frankly, you know, I think I have two choices at this point. They are long, and this tip has to come like this, right?
Yeah.
Yeah. So I will for surely have, I don't want to keep my domes where they are too flimsy, dammi il blu. So whatever I do, I will deproject as I did previously my domes to some degree because I want my domes to come about here.
Yeah.
Having said this, that will mean a little bit of shortening. If I did not do that, I could transact my lower lats here and overlap them. Or I used to do that a lot.
Yeah.
Where the convexity is, about this area, and use a telescoping maneuver about here, okay?
Yeah.
But then in all cases I would add a turn in. This is really wide, so dammi il pennino, vai in effetti. This portion will undulate, all
Yeah.
right? Once that, this is like this. Now once I've done this, it's too long anyway, so either we do the steel thing, or we do a transaction maybe here because it's a little bit more convex. Maybe I do both, I don't know, we'll see.
Okay.
But I need to shorten them somehow, either by steel or by overlap or by a combination of both.
Okay. Thank you.
Yep. The other option could be to actually cut my dome here and do a overlay, sorry, just one in, and that would possibly help me, but I don't think that's worthwhile. It would mean cutting my dome here, and then you have three choices. Do you catch me? Do you understand? Yes.
Sì.
Sono three choices, actually, not two. Dammi il blu. Dammi pure il pennino. So let's figure this out clearly. We have a convexity problem, and the convexity is here. So this is the flat area. And that's the convexity. So, you know, I may well end up in doing two things here. I wouldn't be against it. Let's see. Let's see first what happens when I do my turn under. Lama? But you have a good anatomical reason for his bulbosity and his squareness.
Aghino?
Now this becomes a little bit interesting now because I have to do both things. If I do this, I'm improving it. Maybe it's enough. See, maybe it's enough, or maybe I have to cut here. I don't know. We'll see. We'll go bit by bit. Sutura. We'll take a little bit of time now. 5-0. So we don't have to be impatient now. We have to do this carefully.
Domanda?
See?
Dr. Robotti,
Yes.
do you try to overlay the cephalic trim instead of underlaid it?
I don't know. It depends on the anatomy. In this case, I thought it would be much more. You can do. I mean, you mean this thing?
Yes.
Yeah, you can do that, but I thought it would show less probably. I've kind of wondered this myself. You have to cut it on the inner portion, of course, if you want to do that, because now it would be a little bit late, because I would have to make my cut on this side. It could have been a good idea. I can still do it, but I will just carry on this. Bagna.
No, preso.
You know, one of the problems in doing an overlay, instead of an inlay, is that you may, well, here's thick skin, but it may be palpable a little bit. I have to take care of this convexity, and maybe I can use one of the mattress sutures by Ron Gruber, or I will maybe do something else, we'll see. This will help me shrink the mucosa a little bit, although I have to take some of this mucosa out. Cosa fento?
That's okay.
All right, so if I take this down a lot, and if I tension here, that's one option. The other option is to have a strut here. Of course, I can do that, fammi vedere, but that will occupy space. I could actually strut this area, like this. Fammi vedere il setto. So we'll start by deprojecting. I want to bring my domes here, and then we'll decide. So, dammi la lama. There's different ways. You know, the onlay could have worked. Maybe it would have corrected my deformity a little bit more efficiently. I just don't like it because sometimes I can palpate it. Non è stupida come domanda.
Certo. Quella che...
Mi manca l'altro.
Qua non ce n'è. Uno l'ho già messo.
Dammi la sottura. Apri.
Dai un uncino, doppio piccolo.
Attenzione. I've overlapped them a little bit. Dammi l'altro ago. Ago lungo. Bagna.
Tolgo?
Sì. Lo toglie, ruota. So that's tricky because it tends to bend here. Attenzione che questo tende a... So my knots always come in the inside. I don't like having knots elsewhere.
Prima.
Quanto è lungo?
Taglio.
So I started with some overlapping of these. Now my question is this too, did I shorten it too much? Let's have a look. No? It's correct. Of course he will need wedges. I mean, this thing is massive, right?
Prima steel, poi shorten.
Sto facendo prima stile, in che senso? Non capisco.
Sì, sì. Quello che...
Asciuga un po'.
Lì volevo proporre. Su un eventuale shortening
Di cosa?
delle
Dopo
laterali.
questo, dopo. So, I could also think of overlapping them, but by cutting the domes as well, dammi 5 zeri. But let's start with this lateral cross steel thing. Ho visto, diciamo ai parenti che va molto bene. Ok. Still have a problem here, we'll fix it.
Mettersi.
Not so sure. I think I'll strut it.
Not enough. grazie.
Tieni questo, sì?
You mentioned
Yes.
tension across the tip earlier.
I mentioned what?
Tension with the sutures.
That's what I'm doing,
Yes,
but it's
but-
not enough, you see?
But when you release the lower lateral cartilages laterally,
Yeah, that's a good point.
you
It's-
can't really hold the tension.
You're right. It's a conflicting issue. I've thought of that many times,
Thank you.
but I need to release it, otherwise I will have another convexity here. So my tension is diminished by my releasing them at the junction of the accessories. If you don't do that, it will end up with a bulge here. That's a good point. I have had this thought more than once, but every time I didn't release it, I ended up with a bulge, and so I had to release it. So that tension is less than what it could be. I always check the underneath because I don't really want a through and through suture. Dammi la fresa, quella fresina dello striker. I think we are getting there progressively. I may use one of the mattress stitches, and I want to weaken this just a tiny bit. But you don't have to do this. Non fa freddo su.
No. Stavo parlando.
Suture.
Suture.
You see, when I will do this, this thing will be almost compensated. I will probably strut it. So now we'll leave the tip for an instant and we'll finish the dorsum. I want a little bit more definition. I don't think I should elevate my mucosa from the domes. You know, some people do this. I'm just checking that my suture is not really penetrated. Fammi vedere qui. Oh. So I did the transdomal suture. I'm kind of thinking of an interdomal stitch. And what I am pleased to notice is that I don't need any septal extension graft, since that septum is just tall enough. Allora, non abbiamo fatto attenzione al 3D. L'hai fatto il 3D su questo qui?
Su questo no.
Allora,
Non
è
ancora.
possibile, mentre io sono sus che discutiamo cosa abbiamo fatto, fare il 3D su entrambi i casi?
Il primo l'ho già fatto.
O glielo fai vedere domani mattina magari? Glielo fai vedere?
Mi scusi, il definitivo.
Ma certo, ormai a sto punto andiamo sul
Non ha più
definitivo.
senso
Non ha
fare
più senso,
il
sì.
definitivo.
Certo.
L'altro l'avevo fatto, comunque. Senza video a questo punto, lo
Sì.
facciamo solo su programma.
Sì, sì.
Ok?
Sì.
Come vuole lei? Non mi costa nulla.
Eh?
Vuole stringere a questo punto?
No, voglio capire cosa è successo qui.
Va bene. Li facciamo vedere tutti insieme sabato, dalla presentazione del programma?
No, li facciamo vedere stasera, quello lì.
Ok.
Lo fai sul programma direttamente.
Sì.
Va bene?
No, poi colleghiamo il mio computer.
Sì.
Ok.
That looks actually pretty good. I have a lot of skin to take out here, obviously. All right, so let's finalize the dorsum. Apri.
Altri.
I will just. It's almost. It's very good, frankly, and I don't need to do much. Sutura?
Con
Tieni
più
qua.
alto rispetto.
So I'm putting them under tension. I'm bringing this thing practically on top of my distal spreader. And you can see that this gives me
Cos'è? What is it? Ah, ok. Facciamo
troppo lungo.
troppo?
Sì, sì.
Ok.
Sì. Ma ce ne vuole un po'.
So we redesigned the whole dorsum. Maybe I can take this a tiny bit. Nah, it looks okay. Dammi la lama. I don't really have to do much else. This thing is rather consistent. So having done this, let's see what we can do with these flaps. I know one has been damaged, the other less so. And I will just put them back to their original position. There's not much of an overlap in these flaps, pinza microfrance, since we did not take down any hump. Almost. Actually, we didn't take down any hump. Dovevo usare il 5, però vabbè, era prima, vabbè, pazienza. I usually use 5-0, but it's okay. Certo che preferivo il 5.
Volevo il 6
E volevo il 6 prima, sì.
lamini cartilagine spesse.
Ma sì, lo
3
stesso.
mm su un lambetto. Pensavo volesse stare un po' più. C'è ancora.
In this case, this overlap is good, since I will use it to fill this gap a little bit, okay? I will double breast it.
Double breast.
Sì. Doppio petto e double breast, no? Non pensi?
Double pectus.
Double petto.
Poi no.
So this flap is torn on one side, but it's just covered my keystone. I should have used a 5-0, but I was given a 6-0, so I will bring this somewhere.
Asciugo. Vuole quello
No, I need to stabilize it, otherwise it... And the reason I bring it here is I don't want this thing to fall back. So aqua. On palpation, I can tell you this dorsum is as it should be. Ottone.
6-0.
So now, what are we going to do for this thing? See the use of the dental syringe? I like it very much. nuova lama.
Grazie.
Fammi vedere i pezzi. I want to see the septum I have. Scollino da denti, quello misura grossa.
Ancora tutto inserito questo?
Sì, lascialo stare inserito, quello lì è. Non volevo scollarlo del tutto. So we have to be just, it's kind of tricky, just a minute, I'm deciding. Quello più piccolo adesso. Da denti. I just want to free a space here and I'll decide what I have to do. There we go. Did I make a hole? Yes, I made a hole. Attenzione. Fammi la lama. I have to repair this hole. Giralo. Careful here, careful. Tieni. Prendi la mucosa.
Da quella parte.
Sì, va bene così. Sì. 6-0 Vicro. Eccoli.
Sì, zeri di microrapini.
Okay. Is it a big hole?
Scusi?
Yes, 6-0.
Sì.
So why am I doing this? Because I think I will use the caudally extended lateral strut, hoping it's okay for the convexity. Sutura. I need to close this thing. Boh. It's minimal, dai. Okay.
Maggio? Ce l'ho.
This is 6-0. When I make a hole in the mucosa, it's 6-0 rapid. I didn't really interrupt all the continuity here. You see, I still have something. Do I have something which is straight enough and long enough to act appropriately here?
Too big?
Now let me just see. I will use it. Dammi lo scolla. So this will help me decently, and then I will use my spanning sutures, suture.
5. Si vede bene? Belle immagini lei.
Prendi il 6 per favore, Antonio, è pericolosamente grosso.
6.
È veramente grosso. Tiralo via. E va bene.
Secondo che lo togliamo.
Bene, via. Guarda che non vada, che non shifti, che non giri.
Ce l'ho. 6.
So, my original intention was to have something which would actually give proper structuring. It will give me a little bit of structuring here. It's still a little bit flat, but I will just use it anyway. And I have to bring it. I know this is becoming a bit complicated, but you can see that I'm trying to kill two birds with one stone here, meaning I want to splint his sidewall a little bit and correct the convexity. I can do that to some degree. Taglialo così, sì. Ago. So let's use to advantage this thing. So this is better than on the other side, since I used the convexity, sutura. Dammi anche il 5 se ce l'hai, dai che facciamo prima intanto.
6.
Ma sì, è uguale.
6. C'è il 6 preferiva il 6.
perché ormai abbiamo fatto lo stesso da una parte, sta male, ecco, essenzialmente, anche per il video.
Vabbè.
Stabilizza.
Taglia.
Vediamo le lamine qui.
Dobbiamo usare una struttura di Gruber.
Ok.
Sì.
Grassaglio.
So in a way this thing will also improve the turning point issues. He's a big nose. I want it supported well. So this is better than the other one since that thing was convex and I used the convexity on the other side. So this will go like this, and this is a little bit too convex still. So,
Sì.
so we'll free this even more. Dammi la forbice. Attento qua. I will fully release it like I did on the other side and see if I can get this, right, blue.
Asciuga.
Garzasciutta. That's the concept. I'm kind of gradually getting there. I still have some convexity here. So let's start with the dome equalization sutures. So in like this, this is what I want. So although I have 4 layers since I did the underlay, I still will use the same concept. Aggancialo via.
Vuole che tenga la coda?
No, tieni la pelle magari.
Grazie.
Sì. So I'm equalizing my domes and maybe I can fashion this a tiny bit better. Dammi 6 zeri.
Sono un po' chiuso.
Sì. I need this just a little bit narrower with a 6-0. Bene. Now it's better, and then we'll do something about this. I know I have a problem of the convexity on the right, but I will do something for it.
C'è anche l'arco di sopra.
Certo, sempre. So that's fair enough. The only thing I would want is this. So what should I do now here? Let's use a metro stitch.
Corto.
See if it does any good. No, it's the wrong inclination. Just era un po' troppo
Troppo spesso.
poderosa. Sì.
Hai un'altra
Ok,
micro
infilala dentro. Così. Piano ora, Ok. Lascia andare. Lascia? Ok, it's decent. So I told you that I don't like these sutures, but I used it now. So let's get this thing down. Qual è? Aspetta.
Questa è la tua?
Sì, non importa. And I'll get it down here, so we'll rebuild the valve. Dammi una pinza che sia la mia gialla
Sto giallo.
e bagna. Come stiamo andando? Bene, no? I think probably this one is enough. So this suture serves a few purposes. It's helped, well, yes, he's showing that it helped evert me a little bit the tip, so to some degree. Dammi il 5-0. And it's brought these alers down. So these are kind of semi-transposition things. They're not really a transposition. So where do I bring this? More or less I bring it here, where my scroll was, and I stand at the back of the table and fixate this thing. I shouldn't pull like this, I didn't know it was so long. Rilascialo un pochino, rilascialo un po'. Okay. So this is really rather straight. Actually now it's almost straighter than the other one. Good. Seen from the above, all I need is one more suture because there's a different angle here. So although this looks too many sutures, trovami il tessuto da inserirci.
Sì, tessuto molle. Tessuto molle.
Sì, sì, no.
Tutto qui, guardi.
Bene. So we have these kind of, okay, that's what will lead the sidewall. On the other side is kind of the same thing. So why don't I start with a trial stitch. You know, one of the problems I have this time, I don't really have the material here to do much because there's no septum left. So I may just be satisfied with some soft tissue, we'll see. And so let's do a temporary stitch here. Prendi il ghiaccio.
Ghiaccio per favore.
So, let me eyeball this. The problem is the one I said with redundant skin. That's why we degloved him. That's why when we do the dressing, we'll have to pull everything up. And I have to say, essentially, it looks good. Although, I will have to do wedges on him, for sure, because he's far too big. That we'll do at the end. I wish I had something here at the tip. So looking at his profile, he seems good enough. I know we will use some dice cartilage for him. And dammi il blu. I will need, since my lower lats are like this, I will need to make a pocket for my extensions here and here. Now the only thing I wish I had something, which I don't, and I'm not really prepared to do anything else except use 3DC. He may be a little bit thin here and I would like some camouflage. So let's go down again.
Had you had more cartilage material,
Yeah.
what other grafting would
This,
you be
I
doing?
would have made a thin sliver like this. I would have shaped, dammi il blu,
Okay.
a thin sliver just to go between the sides of my diamond
In the diamond, yeah.
and the diamond.
Yeah.
But I don't have it, which I'm kind of pissed off about because I should really want
you.
it. I really don't want to give him any further donor sites for this. più rappresentante che a me. Fa rumore prima cosa? È fastidiosa per il paziente? I'm talking of a nice machine. We have it today for the first time. We never tried it. I saw it in Stuttgart last year. It's called Hilotherm, Hilotherm.
Non c'è niente. No, tanto c'è l'archetto con loro.
And I just have to see if this thing works.
Ma ci sta.
Lo veniamo a vedere poi.
Secondo me ci sta. Vedo.
So we'll just put some soft tissue there and that's it. It's kind of big, but
E coltello da 7 allora.
I just want something in the middle here.
Spellatore. Grosso.
Mi date una mano per
Sì.
favore? Se no mi resta appiccicato.
6-0.
Stabilizza.
Microfrance. Microfrance. Un altro.
Dr. Roboti,
Yeah.
is this something that will improve the contour of the diamond?
Well, I just want something to help push this soft tissue up. That's all.
Okay, thank you.
I can put whatever.
Running.
Sì. Mettici l'altro. Stabilizza la pelle, se no mi si muove. I really wish I had an extra piece. Now, if I can get a little bit of a contour here, it's going to be better. Probably it would be a case to take a little piece of dermis somewhere, but I don't want to do anything else to this fellow, actually. Bene. So if I had the septal T, but I don't have the septal T would work pretty well to fill this space. Lo lascio? Sì, vabbè, sì. It's just too thick, this thing. I probably will just let it go like this without anything else. Taglia, lungo. And then I'll see if I can. I mean, these segments are just too big. All right. As often happens, this pocket is also a little bit narrow. And the other thing that often happens, spingi, dai in basso. Okay.
Faccio fare una laminette?
Dammi Antonio, dopo. That's it. Lascia andare. Now I need to get this thing in. It's not any, and it's actually too long. Dammi la forbice. So bear with me a minute. I just have to get this pocket correct. So I'm using bigger scissors than I would usually use. But I'm getting to the rim anyway. And since I'm using a kind big scissors and I have a big space, I will use splints for the sidewall, which are little plastic splints at the end of the case. So it's just, I don't want to break it, I need to increase this. And then there's branches of the angular artery here, usually. Spingi la punta decisamente. Ok? Non andare con la suzione.
Lascio.
Something is holding it, which I don't understand. Gira, lascia andare tutto. There we go. So now, it's a little bit tricky. You need to get this thing really in its pocket. Okay? So I'm pretty happy with this. I got a good sidewall. It's a little bit tricky when you don't have the right scissors. In the other set I have a different pair. And dammi il 6 zeri.
Sì.
And I can say I don't need a temporary suture anymore. So let me get this clear. I took my time in putting these extended grafts
Cartilagine si aspira.
in that pocket here and here. All right? So now it's pretty clear. And I have to tell you that this thing almost makes redundant the need of a wedge. We'll see about that. Okay, so PDS.
Taglio. E uncino piccolo, per favore. Quello grosso.
I would like a spacer in the middle here, but I will use some DC.
Possiamo anche inserire la crasciata.
Ma crasciata no. So, there's not much tension here, it's just a little. So let's get back to what we did. It's kind of complicated, but first we did the underlay, like this. Could I have done an onlay? Yes. Could that have corrected my convexity a little more? Maybe, but I decided on an underlay. Once I did this, I deprojected him considerably. Then I did a lateral crura steel. Then I defined, dammi il blu, my diamond, more or less, like here. And I did my dome equalization, stitch from behind. I wish I had some stuff to put here as well. Regarding this, I extended my turning point with my lateral crura extended struts. And I did a little bit of lowering of both ale by joining the upper edge of the lateral crura to the scroll area in a caudal position. If you look at this, you can see that now, after all, you get a reasonable angle here. So that will be fine for him. So the issue is, will there be a mucosal excess? Do I have to take care of it? And do I need to soften this tip, which I will do with DC? All right. I will do a little bit of ala wedges, but it's just a tiny bit. Etilon, say. I could have resected the domes and overlapped them.
Posso staccare la meccanica?
Sì, sì. See the reason I tattoo my incision?
I see you did the acrylic strut, but I don't know how to know when to do it.
Say that again?
When to do the lateral crura strut you did. When was the indication?
Well, the indication was that I wanted the strut to help with my convexity, which it did to some degree. And since he has so much skin, I wanted tension from here to here.
Okay. And that's why you didn't remove any skin redundance?
That's why I Say that again?
You didn't have to remove
I
skin.
will remove now a little bit.
Yeah, but not on the columella.
Not on the columella, no.
Okay.
Because I put tension there.
Thank you.
She's garzasciutta. You know, there's no real truth here, it depends, but dammi il pennino. It's a little whitish here. So, I don't know, I will just take out some of that. Let me measure it. Lo so, però qui voglio andare...
Così mediano?
Oh sì, io voglio andare proprio a chiuderlo qui, It's about 5 millimeters on the stretch here. So while this is working, let me just close the septum, dammi la sutura per il setto. So you can actually see how much this thing was hanging and see now the obvious effect. I thought I would have to put a septal extension graft, but a septal extension graft was not necessary. What do I do with my mucosa? The answer is nothing, since with this suture I'm really pushing the mucosa back. So I go like this, down, up, back.
Quindi un po' poco, ma
And I'm pushing my mucosa back as I'm doing this, chiudi il fuoco. Okay? I use a focusable headlight, as you will notice, since in these instances I want my focus to be contained within the boundaries of the nostrils. That's why I don't like non-focusable portable headlights with a battery. Now there's one which is focusable with a battery as well. You remember I had a mucosal tear on the side of the spur. I won't even touch it, since on my other side my mucosa is fully intact. So I was asked before what I do with it. I cut it, and that's it. Okay? So,
uncino?
let's start the closure here. So we've done so far, quante ore? 3 ore e mezza, so 3.5 hours of surgery, which is what I kind had expected, considering that I'm chatting a little bit. So maybe I would have taken 20 minutes less or something, but not much less. So when I do this, I actually spare the muscle. Lama? So I'm not really taking this muscle. And Gabriele, you were saying, can I use this dermis? Not much, right? Hai visto? So I could use a little bit of dermis, but it doesn't really help much. Beep. Elettrico.
Della carta grassa.
Sembravano coinvolti i partecipanti.
Molto, vero? Tu cosa dici?
Non ho ancora avuto la possibilità di conoscerli, nulla.
Ah, non è vero che non ci
cui-
sei venuto, sì, domani lo vedrai.
Beh, domani faccio anche la speaker.
Sì. Okay? So I usually spare the muscle,
PDS.
PDS, Dammi una pinza che sia quella chirurgica un po' più grossa se ce l'hai, se no. Ma va bene, va bene, va bene. Aspira. So I want this thing to touch itself. I really don't want to depend on the skin tension. So these sutures have to be taken out, except one maybe early. So I don't, it's a sebaceous oily skin here. Vediamo. Sei zeri? See, I've not really entered the vestibular surface here, there's no need. It will just come down.
Guarda che mi ha caduto un po' taglio.
One of the main things when you do these resections, either if they are seal or vestibulum or both, you really need to have this arch maintained. If there's a terrible thing which you cannot solve, is when I see these secondaries, when somebody has done a wedge and the whole thing is verticalized. It's like this. It's like this. There's no rounding here. So this rounding is the main thing. And once you lose this, it's almost impossible to come back. Dean was talking about composite grafting for this, but I don't know, I think it would show. Maybe you can use it. Io ho bisogno della sutura.
Ho già provato.
So you didn't notice this, but at a certain point during surgery, maybe a couple of times, I went back to my checklist, which was on the wall, on just behind me. And I need to do this because I don't want to forget anything. Lama? All right, so you see I am, one of the main things when you do this wedge resection, I don't really, unless I have a need for it, I don't go in the vestibulum. So the way I do it is this, and then I just close it directly. I don't really carry this in the same way inside. Because this mini bunching you have in the beginning will soften very quickly, and it will preserve, grazie, the natural arch here, which is the problem when these things have been done rudely. Let's see where we will put our diced cartilage. All right, so I may just put some dice for whatever I see here.
No, è dietro di lei. Ah, dal profilo sì. It's too late.
È uscito questo, Antonio? So I will put some more cartilage. So why is it doing two of them? Because one is stiffer, it will lead me to the radix. Dammi l'altra. So while he's preparing the last little bit of DC, I will close at least on one side. All these sutures are usually wrapped in bathed in betadine. The reason is it's been studied by Don Lalonde. He's Canadian. He's the one who edits the PSEN on the web, which is a sister thing to the PRS. And the reason is, number one, it slides better. Number two, if you look at it under microscopy, all these A vicryl suture has a lot of, it's like a multi-fiber thing, it's like a rope. And that's Phẫu for bacteria, and so if you betadine it, you are having two advantages at the same time.
Il bus parte tra 5 minuti.
Sì? Beh, tanto deve aspettare lo stesso l'autobus, 5 minuti è così fatto che può aspettare. Dategli 5 minuti, gli faccio vedere le splint.
Okay.
Let me show you essentially what I do with these nasal splints and why. So what does this thing do?
Non lo metto più adesso.
Dopo, prima fammi questo. It gives compression. And I learned this from Rod. And I think it's a good way of killing any dead space you have here. Remember, I did my big pockets here. Dammi l'accesso. Antonio, finisci poi con le suture che servono. Ok, it's enough, lascia. So the way I do it is as simple as that. It's a transfixion thing. I'm sure you've seen this before. It's nothing new. But I think it makes a difference when, in cases where I do considerable surgery to my sidewall.
Bravo. Ce l'ho.
Mi ho tolto già la pinza, porca
Pinza
miseria.
Non l'ho presa io.
So it's the same concept as the septal transfixion suture, and that's it. So these things are kept until tieni, the steri-strips and the plastic splint come off, which is 7 days, of course. So see the reason I just have selective compression. Now, last DC bit, remember we wanted to use it at the tip. So I have to find a way, uncino, stai perdendo il filo. So I want this thing exactly here, where I told you before I may need it. Spira. And this is going to be my final stitch.
No. We still need the doils.
And then we need the doil, of course. Yes. Before I tape him, let's get the final 3 views and then I'll say good evening. Okay, Lascia. All right, so his profile, I would say, is reasonable. All right, so it's pretty clear what we did. Okay, it's pretty clear. Okay, so this is from above. So I'm really happy about the width of the dorsal lines, and I'm happy I did not do an osteotomy on him. His grade of asymmetry was well controlled by osteoplasty. I did deepen his radix. All right, so it's pretty clear. All right? It may not be perfect, but it's as good as I can do it. Okay, thank you very much. Grazie. All right. I'm just taping, and before I tape, I will get tension on the skin here and here. So remember, we did full degloving in this case, full degloving. And so I want the skin to adapt. So now we will put the aquaplast. And I think we can kind of leave it like this. All right, Nate? Yeah. Good.